My name is Peter Fonagy. I have the privilege of chairing these proceedings. It's a source of pride for UCL Partners to have worked with Health Education England in trying to build a program that provides awareness and enhances the skill set of workers in both mental and physical health and assures reciprocal skills exchange for these groups.
Today really is about getting into some of the nitty-gritty of how you practically integrate physical and mental health. It is very pleasing to see any Prime Minister of a country stand up and talk so importantly about mental health. And she talked about mental health both in the need to have a greater sense of equality and a greater sense of focus on those living and recovering from mental illness, which is extremely welcome. But she also talked about the importance of children, young people, families, schools, and also about the promotion of good mental well-being and some preventions.
I just encourage people to think of people holistically. And I know through different organisations I've been involved in, some people with cancer say that their doctors will look at blood tests but won't look at their emotional health. So I just encourage you, from the bottom of my heart, to look at people holistically, to look at their mental, physical, emotional and spiritual needs.
We've had years and years and years of the NHS competing. You know, Trust X competing with Trust Y for the business commissioned by Commissioner Z. We're moving away from that. How can we work collaboratively together to make things better? Because the reality is that if you're working in an ED, you absolutely do not want patients coming with mental health crises and having physical health problems as a result. You want to be able to stop that. You want to have patients with better care. It's in your interest as an acute provider to work with your mental health trust to make sure that the patients have better care and better well-being. So let's start to do that in a real way.
So we all know that you can provide basic life support, but a strong emphasis on our training is the human factors end of things, is working as a team. And the scenarios are so designed to be especially stressful. When people are under stress, they sort of forget what to do and everything sort of gets fairly chaotic. And simple things like communicating effectively as a team can break down.
We hope to adapt this model to provide a similar mental health focused simulation day. We're planning to do this through creating an initial programme that we will do at our own simulation centre at UCL, but then providing the ability to roll this out to further simulation centres.
I just flashed this slide up very briefly. Some of you have probably already seen it. It's a study that Young Minds did around self-harm, which is just one very small aspect of mental health. And you can see on the healthcare professionals that even for something just as self-harm, which is actually very common, as I'm sure you know, at least half of GPs just didn't understand why people did it. And about 3 in 5 just didn't know how to talk about it, particularly to young people. And that's just all young people, that's not just young people with learning difficulties. And I think it gives you an idea of the difficulties with breaking down barriers.
There are still some barriers to break down. For example, I'm a nurse and we still train nurses to have separate registrations in both mental health and physical health care. How sensible is that? So I'm afraid it means that we turn out nurses, and I can speak for mental health, that where we have to provide an awful lot of investment in topping up their training and knowledge in even fundamental and basics.
What we need to take forward now is a genuine sense of enthusiasm. We are empowered. Let's ensure that when they write about what we did into the future, we won't cower from the public eye, but we will stand proud because we did what we believed in and we broke down the barriers and we made an enormous difference.